I cannot overstress it that until the very last case from anywhere in the world is sorted out, every country, everybody in the world remains at risk. But that is not to say we should shut down the whole world. No. As long as we know what we are doing, we should continue with our lives.
The Minister of Health, Professor Onyebuchi Chukwu. But unfortunately, Lagos is not the only state that has recorded cases of EVD. In Rivers State, South Nigeria, there are 4 cases of the Ebola virus disease, and 2 of them have died. The Commissioner of Health said that as at yesterday, there were 377 contacts who are still under surveillance.
We have successfully treated and discharged an Ebola patient from our treatment center. She was positive and she's now been treated successfully, and she's now negative and discharged to the community. We had another discharge, though that was a symptomatic contact. We tested and left, but the high point is this successful treatment and discharge. We all need to be on bended knees this week, next week, and we'll be coasting home. You know, as I told you, it's a 21-day disease, and most of them will be rounding up this week. So if we are not flooded this week, next week, then we will be coasting home. All hands will be on deck to make sure that we are prepared for any eventuality. We have about 479 contacts now. About 94% of them are being followed up, and by today we'll cover all of them. Points of entry are now, I can say they are now well covered. Points of entry.
The Health Commissioner, Samson Parker. Now, other states in Nigeria have set up isolation wards, and the governors have stated their readiness to fight the disease should there be any need to do so. In fact, it's been holding a workshop to educate people on what to do if the EVD ever presented itself in various states. But now let's talk to our health correspondent, Mary Alale Yusuf, who is joining us live on The World Today. Mary, thank you so much for joining us on The World Today. So,
thank you for having
we're
me.
curious now. There have been cases of, people who have actually been, how do I say this now? They've actually been declared healthy after being suspected of the Ebola virus disease. So, what is the mode of treatment? What is being used to treat these people?
Essentially, Ebola virus disease has no treatment. But what they do is they sustain the person and give the person treatment as needed for symptoms that show up. If there's diarrhea, they rehydrate. If there's pain, they give painkillers. They just ease the person through the process of the Ebola virus disease. Viruses don't have a cure, but they run a course. And if you can sustain the person while the virus is running its course, he can come through. It's the same with every other virus, except that Ebola is so much more deadly. That's why people are so scared. But you sustain the person so that his vital systems don't shut down, and so that you keep up the immunity of the system, and it can uphold the person, so to speak. That's essentially what they do, just keep the person going.
So what kind of help has been provided by the international community as promised, when the disease first broke out here?
Well, the international community has been wonderful. They've come up with support by way of personnel, people who are experienced, and they've trained our people. The training for treating Ebola patients is very specialized. Anybody who needs to treat an Ebola patient has to go through this training in order to protect himself, because this is really a virulent disease. And once he can protect himself, aid workers and health workers are the highest casualties in this outbreak. But once they can protect themselves, we have a major part that is we're not so concerned about anymore. We just watch those contacts, see them get better.
So we understand what the international community is doing, but since we're in Lagos, let's come back to home right now. What is being done by the Lagos state government? Has it upped its game since, you know, efforts we saw when it initially broke in Lagos upon the arrival of Patrick Sawyer? What's been done by the Lagos state government? Because we seem to be doing quite
It's
well.
been very impressive. The Lagos state government, and not only the Lagos state government, there's been a lot of enlightenment campaigns, a lot of teaching, a lot of information going out there. And people have gone as far as getting churches, getting traditional rulers, people who are crowd gatherers, to educate them so that they can, you know, gather in their crowds with more caution. I've even seen in churches and public places people carrying sanitizers about and using them on anybody who comes in. So there's a lot of enlightenment out there.
Now, I'm a bit curious. I know that this is not happening in Lagos, but in Liberia, we saw last week where a man escaped from an isolation center saying he was not being fed, and he went to the market to hunting for food, basically. So, what exactly is happening in the isolation centers right here in Nigeria? What kind of equipment is available to address the suspected Ebola
Well, you
disease
must
cases?
understand, Cynthia, that these countries we're talking about, all these other West African countries, they are coming out of difficult times. Some have had war, they've had problems with their leaders, problems with governance and all that. But Nigeria has been relatively stable. So we are not facing a sort of poverty problem as they are in those places. Imagine a patient escapes from a ward to look for food. That means that food is a problem. And I'm aware that the World Food Programme is even there providing food, giving food to those who are under surveillance. But here, at least, we don't have a food problem.
So what do we have in our isolation centers?
We have our basic infrared indicators to show the temperatures of the patients. Then there are health workers from different callings, so to speak. They're the epidemiologists, there are, you know, all sorts of workers, people who will take care of different aspects of the patient's needs as and at when due. So every aspect of clinical care for the Ebola patients is being taken care of in Lagos.
I'm still a bit skeptical concerning that, if every aspect is being taken care of, because we understand that, you know, there have also been a record of the number of deaths in terms of the health workers. We understand that about 79 health workers have passed on while, you know, administering treatment to the affected patients. So do they need something a lot stronger? Is what is in the isolation centers enough?
Well, 79 health workers dying is not in Nigeria. Most of them are in other countries. We've had a lot less casualties here, and things are getting better as the days go by. You recall that most of these health workers died earlier on in the Ebola outbreak, but now there's so much more success. You know, the success rate has really gone up because there's been training. And you know, unlike other places, we didn't have the problem so much of denial as they had, you know, perhaps in Liberia, yes, where people were saying this disease does not exist. I think we've had a healthy fear in Nigeria, a healthy fear, a fear that makes you report your neighbor. I think this guy is sick. A fear that makes you call Ebola help, our helpline. You know, a fear that makes you wash your hands, a fear that makes you clean up your surroundings, not panic as they had in some other places where people ran amok and broke into an isolation center and freed the patients. That was, I'm quite sure that was a major setback in their Ebola care there. But here in Nigeria, we have been on top of things, and I must commend Nigerians. They have been great with their response, and they've been wonderful, really.
Well, since you're commending Nigerians, I'll say thank you since I'm Nigerian, and I will continue to exercise my healthy fear. Thank you so much. I've been speaking with our health affairs correspondent, Mary Alale Yusuf.